This is my transformation grid. The transformation grid, its name is pinged off of an activity developed by Dr. Bill Padula, neuro-optometrist, from his transformation cube. Now, the transformation cube is to shift one's perception from which square is popping out. Is it the orange or the red, or is it the green? And can you shift that back and forth? However, the transformation grid is a little different. What we're going to do is I'm going to say, do not look at the lines. This is about looking at the spaces. You want to see this plus pattern here. Can you recognize the plus pattern? And then once you recognize the plus pattern, can you shift your perception and recognize this X pattern? Call it whatever you want. Some patients call it the 5, others call it the X, and then can you shift it back? The transformation grid is you're going to recognize one pattern, that is the cross or the plus sign, and you're going to switch it and recognize the 5 pattern or the X sign. And you're going to switch it back and forth, back and forth, back and forth, and all you're doing is changing your recognition. And as you change it, you should see that the boxes just slightly appear to move. That's the activity. It's not about holding it, it's about the shift. Because when you change your recognition of the pattern, there's going to be a slight motion shift. And that motion shift's going to work on the periphery. A lot of the people who have difficulty with this or are very zoomed in on their vision will have difficulty getting the X. You just practice, and you practice multiple times a day. So you cannot use the animation. You have to do it mentally. The animation can't do it for you. It doesn't work, or at least it doesn't work for me. And I haven't known anyone else where it doesn't work. But what I would have you do is you would stand at a Snellen at a distance to where you can see at least the top few lines, even if it's not perfectly clear. And you would look at the grid and do the cross, then the X, then the cross, then the X, then the cross. There's no reason to go super fast. Just a comfortable rhythmic pattern should be your goal. And you're gonna see those lines, don't look at them. They may go double, they may go clear, they may go blurry. It's gonna come in and out once you get this down. That's at least the experience with me and my patients. And then you're gonna look real quick and you're gonna judge the clarity. Don't hold on to it, because when you hold on to it, you're gonna shut down that visual motion. And it's gonna get blurry again. You're gonna do it again, back and forth. You're gonna do it a few times, do it as you're comfortable. And then when you look, you don't look directly at the letter, but you look at the spaces. You wanna look at the shape of the space. So this long rectangle, this long rectangle. Look at the imaginary space that is going behind the letters in the white abyss. So if I imagine that these letters, there's a white abyss here, and these letters are floating there, I may be looking at the letter, but I'm thinking about that space. So it's the space. And if you go to the space, the letters may not seem quite as blurry, maybe. I mean, this is not easy to do by correspondence, not even a video. A lot of people who have difficulty with this don't exactly get it and really need a doctor who might be familiar with these visual motion principles to walk you through this and to understand when you are zoomed in too much, is how I would put it. Other doctors may call it other things, but if you look hard at a letter, really hard, you'll notice it goes blurry. Like, zoom in on it. Forget about everything in your awareness except the letter. And if it goes blurry, then you go back and flip this pattern, alternate it back and forth as a rhythm pattern, and then go back and make sure you're zoomed out into that space. And if you need a quick video on what I mean by zoom in and zoom out, I have a lens video for you to watch. And just see, and that's how you can see if you can gain at least even a tiny bit of control over the clarity.